Have you ever had an insurance claim denied? Well, you know the frustration and the fight it could take to get it reversed. And now, a new kind of ally is stepping in to help. We're talking about artificial intelligence. Here now to share how this tech works and whether or not it could change the balance of power between patients and insurers is Neal Shah. He is the CEO of Counterforce Health, which helps people write insurance appeal letters with AI for free. Welcome to the show, Neal.
Thanks for having me, Chesley. I really appreciate it.
Not a problem. All right, what made you decide to take on insurance appeal process and offer it for free?
You know, I went through a multi-year cancer journey taking care of my wife. And, the hardest part of the whole thing was actually fighting the insurance companies. And then later I've been running a caregiving platform, helping tons of older adults across the country get care. And I'm seeing the same thing, kind of out in the field. A lot of people are fighting health insurance companies when they're taking care of a loved one through serious illness or disability. And I think it's just an absolute tragedy. So I kind of thought, okay, what can we do using our skills and modern technology to help people fight back? So that was really, the origin of the idea.
Gotcha. How does AI actually build these letters out?
Yeah, so what happens is when these health insurance companies deny your claim, you got to go through a lot of medical records. You got to go through your policy coverage document. You got to upload things. Like, it's hundreds and hundreds of pages. And to take a regular person to do this, which I've done, would take 8 hours, 10 hours of work. Some would take 5 hours to write all this stuff. The way our AI works, and this was kind of a fun project that we built, is you can upload all your documents and it will parse through them, and in less than 2 minutes, it will give you a very well-crafted letter. It is trained on billing code databases. It's trained on successful appeal strategies from a lot of state insurance regulator databases, and then it keeps learning over time. So not only can the AI do in 2 minutes what it might take you 8 or 10 hours to do, it can actually do a better job. So 70% of people are winning their appeals. And I think that's just like a really cool thing, for people to have at their disposal.
Yeah, I was going to ask you what kind of success rate are you seeing so far? And so you just mentioned that. How quickly are the denials being overturned?
Sometimes same day. Believe it or not, we even have clinics using it. And by the way, I forgot to mention the tools are completely free to use. We are a social impact organization, fully grant funded, so we don't charge people a dime for this stuff. And I think it's a human tragedy what's going on. All these people having to fight back against health insurance. So completely free use. Individual patients are sometimes winning same day, next day. Clinics are using it, and they're sometimes winning same day. So it's really cool to see. If you write a really well-crafted appeal letter, you have a good shot of winning. Oftentimes it's like an administrative error by the insurance company, or sometimes they're just testing and doing it on purpose to see if you'll actually respond and fight back.
Wow.
So doing this in 1 or 2 minutes really eases the burden on a lot of people.
Have you noticed certain types of cases where AI is specifically effective?
Yes, AI is very effective in medication denials. So a lot of times people are denied access to critical medications, whether it's rheumatology, autoimmune disorder, whether it's oncology, cancer, other needs. A lot of times medications will be denied, because they'll want to see more evidence, more proof that you actually need it, especially if it's like a second-line treatment. So we're seeing high efficacy in that. So I'd say oncology, neurology, rheumatology, we're seeing very, very high.
Some insurers are being accused of using AI to deny claims. Do you see this as a AI fighting AI kind of a situation?
I do, sadly, and that's really why we built this. So I actually wrote about this. I put a book out, Insured to Death, and I'm happy to send to anyone if it's free. So just email us and reach out to us. But I wrote an entire book on what's going on. Health insurance is using AI to deny people programmatically, sometimes in like as little as a second. No one's even reviewing this stuff. So if you have to write a letter and it takes you 8 hours or 10 hours, no wonder people are not going to fight back. They're going to give up. So I think that it hasn't caught up yet, and that was really our mission, is how do we build tools to kind of arm the resistance? It is going to be AI versus AI. And, if you're writing it manually yourself, it's not a fair fight. So we're very passionate about this. In the book, I share a lot of appeal strategies. Again, happy to give it to people for free. Just email us or reach out to us. But, our mission is that we think the field has been tilted towards insurers. And, denial rates have gone through the roof over the last few years. Some people, there's 25% denial rates at some of these companies. And, an interesting statistic is over 1 in 5 adults in America have been denied a health insurance claim over the last year. So it's kind of, I personally think this is ridiculous. Like, what's the point of having health insurance if when you get sick, you get denied?
Right. Yeah. Neal, thank you so much for your insight on this, and thank you for what you're doing, man. I really appreciate it.
Thanks for the opportunity. Happy to help people.
All right. Take care now.